Welcome back to video 4 of the EKG Detective. For this video, we will be looking at premature atrial contractions. The EKG Detective is dedicated to helping people make the transition from using inductive logic to deductive logic. And if you'd like to learn a little bit more about the difference between the two, you can go back to video 1, where I spend some time talking about the differences between the two. Throughout this entire series, we are going to use two job aids. The first job aid is the EKG Detective Interpretation Checklist. The nice thing about this checklist is it really helps illustrate the mechanics of how deduction works. And if you're interested, just reach out to me at relevanceineducation.com and let me know that you would like a copy of the checklist, and I will make sure that I email one out to you so that you can use that as we go throughout this series. The second job aid that we are going to be using throughout this entire series is the EKG Detective phone app. It is available at the Apple Store and the Google Play Store. All you need to do is keyword search EKG Detective, and it will take you to where you can download a copy of the app. It's something that's not required, but it is a little bit easier to use in the aspect that it will more directly walk you through the process of deduction than the checklist will, but you by no means need to have a copy downloaded to work through this series. So the biggest question to ask is who can benefit from using EKG Detective? And the answer to that is anybody who is struggling with an ECG interpretation. The nice thing about this process is it allows you to focus on the waveforms and the things that you can see in the ECG, and you don't have to spend as much time focusing on the criteria within an ECG. Before we jump into looking at PACs, let's talk about the term ectopic beat. All normal beats originate from the SA node. The term ectopic means an abnormal place or position. So that means that an ectopic beat is any beat that originates outside the SA node. PACs originate somewhere within the right or the left atrium, but not the SA node. So they are considered to be ectopic beats. So jumping into the app, the first question it's going to ask is if the rhythm is regular or irregular. And since we have a PAC here in the ECG, it is going to cause irregularity. So we are going to select irregular, and then we will hit next to go to the next screen. Now referring to our EKG Detective checklist, since the rhythm is irregular because we have the PAC, we're going to get rid of all of the regular rhythms. But for this video, we are not going to be focusing on the underlying rhythms, so we'll get rid of all of the underlying rhythms so that we can primarily focus on the ectopic beats. Once we determine that the rhythm is irregular, the app is going to ask us if the irregularity is possibly caused by PACs, PJCs, or PVCs. So I want to review the criteria for PACs, PJCs, and PVCs. For PACs, those beats are going to have different looking P waves when we compare the P waves from our underlying rhythm. The same will hold true for PJCs. And when we're looking at PVCs, those beats are going to actually have totally different looking QRSs from the underlying rhythm. So when we look at our underlying rhythm, we have all of these P waves that are similar in morphology. And then we have this beat that has a different looking P wave. So since we have a beat that has a different looking P wave, it is caused by a PAC, PJC. And at this point, it's not a PVC because we don't have any totally different looking QRS complexes. So we are going to go to the app. We are going to select yes, and then we will hit next to go to the next screen. So I want to talk about what actually causes or how we determine a rhythm or a beat is actually a premature complex. By definition, a premature complex is a beat that occurs early in the cardiac cycle. The way that we determine if it's coming early or late in the cardiac cycle is we want to measure the R to R intervals for our underlying rhythm. Once we have that R to R interval, then we can carry that interval across where the ectopic beat is. And if that beat occurs before the next expected beat, it's a premature beat. And if we look at our premature beat here, we know that it is coming before our next expected beat. So that's what makes this beat premature. Going to our checklist, since the ectopic beat does not have a different looking QRS complex that is wide and bizarre, we will be able to eliminate premature ventricular contractions because those have wide and bizarre QRS complexes. The next question that the app is going to ask us is if there are different types of PACs or PJCs. This question is important to determine if you have multiple ectopic beats, whether or not they're coming from the same location or different locations. Since this ECG only has one ectopic beat, we are going to select no in the app, and then we will hit next to go to the next screen. Referring back to our EKG checklist, at this point, since there are not different types of PACs or PJCs, we aren't going to be able to eliminate either PACs or PJCs at this point in time in the process. Question number 4 is going to ask us if the actual PACs or PJCs have P waves. So looking at this ECG strip, the premature beat does have a P wave. So we will select yes in the app, and then we will hit next to go to the next screen. And referring back to the EKG Detective checklist, since there are P waves for these ectopic beats, we are not going to be able to eliminate PACs or PJCs because both of these beats actually have P waves. The next question that the app is going to ask us is if the possible PACs or PJCs have P waves either in front of the QRS or after the QRS. And if we look at this specific ECG, the P wave is in front of the QRS. So we will go to the app, we will select in front of the QRS, and then we will hit next in the app. And since the P waves are in front of the QRS, with this, we're not going to again be able to eliminate premature atrial contractions or junctional contractions because both of those types potentially have P waves that are in front of the QRS complex. The last question that the app is going to ask us about the ectopic beat is what the PR interval is. So looking at this PR interval for our ectopic beat, it is measuring right at about 0.16 seconds. So since it is 0.12 seconds or greater, we will go to our app and we will select 0.12 seconds or greater, and then we will hit next to go to the next screen. Referring back to our EKG Detective checklist for the last time, since the PR interval is greater than 0.12 seconds, that means that we can eliminate premature junctional contractions because if there is a measurable PR interval for those, they're going to be less than 0.12 seconds. And since the PR interval is 0.12 seconds or greater, that leaves us with our one and last option that we've been working with, which is premature atrial contractions. And that's what the ectopic beat is in this ECG tracing. And referring back to our app, once we select the PR interval, the app is going to tell us that we have a premature atrial contraction that we've been working with from the very beginning. All right, that brings us to the end of this episode. I just want to reiterate, if you would like to get a copy of the ECG Detective checklist, just reach out to me and I'll make sure that you get a copy of it. Also, if you have any questions about the EKG Detective phone app, you can reach out to me at relevanceineducation.com, and I would be more than happy to try to answer any questions or get you the resources that you need. And if you haven't done so, I would really appreciate if you would subscribe and like this video because it definitely would help out as I'm trying to get this channel up and running. And I appreciate you for sitting through this video, and just remember that it is always better to practice as a clinician rather than a technician. See you next month.